so now we're going to move on and really ask ourselves this question. Is the lecture dead? Right?
No, I just gave one.
I know, and I'm about to give one too. But I don't know. That's what we're going to think about, right? So we're going to talk about how to really utilize active learning strategies. And so before we answer this question, just by like a show of hands, how many of you guys have some type of like lecture or classroom-based activity in your courses? So it seems like almost everybody. How do you guys feel about the amount of time your students spend doing those activities versus their amount of time doing other more active stuff like clinical shifts or ultrasound scanning?
We've removed all lecture format things in our Clerkship and created online modules that students can go through at their own pace, and then all of our in-person stuff is really assessment.
Mm-hmm. Yeah, that's great. So you can come give the lecture next year. That's awesome. Any other thoughts from anybody else?
That's what we did too, because it felt bad to be using faculty time, which is a precious resource, to be yammering at people when we could be using that time to be engaging students in a more active way. So that's why we went with online lectures as well.
Yeah, and I think more people are moving in that direction. But I will say there are definitely still ways to make even online lectures more active and just bring this thought or this ethos of active learning to all kinds of different activities. And so what really is active learning? When I say that, what do you think about?
Case-based.
Case-based, great example. Other thoughts? Hands-on, yeah. So we're like the students actually like doing something. Learning is effortful. And so these are kind of the way we like this typically described, like the sage on the stage, which would be like what I'm doing right now, right? It's very teacher-centered. We're here and we're talking to you, delivering information, versus more of this idea of like guide on the side, which is really learner-centered. So the learner is the primary motive and driving things forward. And this is one quote that I really like. You know, learning is a process. It's not a product, right? And it happens inside the individual. And so we assume that learning has occurred by judging some type of product, a presentation, a performance in the emergency department, but we're not actually inside their brains, and we do not actually know that learning has occurred. We can only infer this. And so we can't make anybody learn. All we can do is try and really maximize conditions for learning. And so I think that's always important to just kind of keep in mind. And if we do things like have a bunch of multiple choice tests or have high stakes examinations, right? What kind of learning are we encouraging? What are we really promoting within the students? And is that really what we're driving for? And so what are some of the goals of classroom-based teaching? Like, is it ever okay? Or what is some value to it? Like, we still have some in our courses. Deliver information, yeah, good. Engagement. And so here's some I thought of. So it's just to develop knowledge base, right? Like sometimes you're teaching something that like they just really don't have any clue about. It's the first time they're hearing it, and there can be some benefit to doing that in a big group, in person that first time, particularly if it's more complicated, to really walk people through it and help them get that foundation before you turn them loose to watch videos. It can help with higher order thinking skills, so really trying to push people, beyond just like recall, list, describe, but really like analyze, compare and contrast, or apply things. It can help facilitate transfer to other contexts and problems. And it can also be an opportunity for collaboration and developing shared knowledge. And so sometimes it's not so much about what's being taught, but the process that the group is using to learn is actually where the true value of having them together in a classroom is. And again, kind of that teaching how to learn and role modeling that. And so just, some general principles, regardless of what you're doing around instructional design, is we always want to make sure that there's congruence between your learning objectives, the strategies that you're using to teach those things, and like Luann just talked about, how you're actually assessing those things. And so, and we always want to try and use multiple different instructional strategies and thinking about your resources. As we said earlier, right, like faculty time is valuable, and so really looking at everything you have within your clerkship, within your course, and saying like, is this the best strategy to really get at what I want from these students? And so we'll kind of go through like the easy ones, like the low-hanging fruit, to the more complex, completely putting your course into like online modules. And so if anybody has used any of these or has experience that they want to share, please, we're a small, intimate group, so just shout it out. But these are some things that you can just do with any lectures that you already have without really spending a lot of time or a lot of energy. So one is like a pause procedure. So the 1-minute paper is a good example of this. So like at the end of the lecture, you just have people give them an index card, or they can use their smartphones or whatever it is. You just have them write down like what were some key things that they learned from the session. And so it just forces them to stop and try and consolidate some of what they've heard. You can do like the muddiest point, ask them to write down what was the most confusing thing, or what is your biggest question from the session. And again, it provides feedback to you, but it really just asks them to like stop and think, which can promote learning. You can use case-based scenarios, and so not like full formal case-based learning, which we'll get to, but just opening your presentation with a case, because it puts them in that mindset and helps them integrate that knowledge. And you can use cases throughout your lecture, the beginning, middle, end. It all will sort of work well. The other thing is commitment exercises, and so that's what we did at the beginning when I said, who has, lectures, and what do you think about that, right? So you try and get them engaged, you get them to commit to something. Online, like polling is great for this, like Poll Everywhere. I mean, if you're really low tech, you could use index cards or hands like we did here. And so anything that just tries to get them engaged in that material. Concept maps are also fun. Has anybody used these before? So we use these in one of our courses, and it's always really interesting to me. The students really struggle with this. We have them kind of create like this algorithm for approaching a patient who's potentially poisoned, right? And so it deviates from what you usually do a little bit, because you're thinking about an acutely poisoned person. And so it's really, it can be difficult for them, because they're like, well, what's the right answer? So do I have to, how many like lines and bubbles do I need to have? And we're like, no, it's not about that, right? Like everyone's map is gonna look different, right? It's about thinking. And so it really does kind of, force them to think about these concepts and how they're relating them together. And it's hard, right? Like they're uncomfortable doing it. And so really trying to kind of set the stage for them that this is okay, right? Like this is learning, and it's not about like getting a pretty perfect map. It's about thinking that occurs to get you there. And then social media, I'm not like a huge social media person, but if you are, that can be a great way. People have had success with having like Twitter chats or, just other things, and using that also as an educational platform. These I think of as like quick additions. They take a little bit more time than things on the other slides. So think, pair, share, right? You give people a moment to kind of think alone, you pair them off together, and then you can kind of share out into the world. It's great if you don't have a very talkative group, or maybe you have young or early learners who are kind of afraid to speak up in the group setting. It can be really helpful. You can do role plays, not everybody's favorite, but usually I'll pitch it as like a sort of a low fidelity simulation, right? And then people don't really think of it as role play anymore, and they get into it. Debates can be super helpful. Any kind of educational game. We use like an educational board game in one of our courses. It's a lot of fun. People really like it. And then Snowball can be fun if you have like a larger group. Has anybody done or participated in this before? And so usually what you can do is you give some type of content, you ask some kind of thought-provoking question, and then people on an index card, they write down kind of 3 to 5 sort of points from that. And then basically they like sort of start to walk around the room, and they find one other person and they share. And then that group of 2 finds another group of 2, and then they're now in a group of 4. And so it can be really, it needs a bigger group, but it can be kind of fun because it brings people together. It gets them moving up out of their seats and moving around the room. Now these are some what I think of as lecture alternatives, and so these things take more time, more effort. So you can do the flipped classroom model, where you have something in the pre-class, they come together, usually do some type of classroom learning, and then there's post-classroom learning. In pre-class, it's asynchronous, it's independent, they're typically learning some kind of content. I found when we've done this, like it's really important to make sure like do pre-class work. And so like we needed a mechanism to make sure that was happening. Otherwise they sort of just came and were like, all right, we're ready, teach us, right? And you really need them to engage in whatever that pre-class material is. And then the classroom learning should be, different than this, right? It should be really like application, synthesis, some of those higher order things. And it should be cooperative so that they're working together, thinking together. And then post-classroom learning is a part of the, if you want to say tried and true to the flipped classroom model. I think sometimes that's the part that's sort of like left off. It like ends with the classroom activity, but really there should be some other kind of post-learning after that, some type of more deep learning or some type of self-directed learning. Anybody use this model that has other like tips or pitfalls that they want to share? So it may be an assessment, and so that is sort of like up to you in terms of how you want to design the post classroom learning, but it doesn't necessarily have to be an assessment.
I don't fully understand what the deep learning and self-directed really means, because like for us it's pretty much exactly this, and then that last point is a non-graded 6-question quiz on the single module that they go through.
Mm-hmm.
Well, just another, it's not wrong, right? Especially if it's a non-graded quiz, it's formative, they get the right answers or have an opportunity to talk about it, then it's still learning. Like, I do simulation, so what we do in the classroom learning part, it's going to vary a little bit depending on the skills and knowledge of the group, but we always identify as part of our debriefing one thing that remains unclear or one thing that the learners need to understand better. And, I cheat a little bit. I have like a mini mental list. So the trauma case, like you're going to learn more about the physiology of shock, or you're going to learn about TXA or whatever. But then, we have them read a paper about that and bring that back to the next session, for example, as just like, okay, you did this case, you had this experience, you practiced managing this trauma patient. What was there that you didn't fully understand how it worked or why you were doing it or how to get it to work better? And then they would do a post-classroom assignment related to that.
Yeah, and I think that type of assessment, that's fine to do that. I think, again, it just meant like, what is the point of the activity? Like, what are you really wanting them to get from it? Like, could you do a couple short answers, right? Like that would push them further into the material. Could you ask them to like reflect on something, or write a goal for how they're going to use what they learned on their next shift? Like just anything to push them sometimes just beyond like, yes, I can remember like the difference between the probes.
Some kind of active, they have to do it. Okay, I think I'm right.
And nothing's right or wrong. It's just ways to try and drive deeper learning that hopefully sticks a little bit better for them.
I think that we were asking about pitfalls is you have to really think about how much you're going to put on the pre-class side of
Mm-hmm.
this.
Yes.
It shouldn't be 2 or 3 hours of work before you come together so you effectively double all the time.
Yes.
Really think about what's meaningful, how you contribute for your impact on the session.
Yeah, that's really important. And so one thing we actually started doing is actually like labeling like time for them, because then it helps them see like this is the time I'm supposed to be, like they don't have to do it during that time, but it's labeled, it's on their calendar. And then it also helps when we count course hours, like, okay, yeah, like, this assignment takes, we anticipate to take 45 minutes, and we're gonna give them an hour and a half, time to do it. And so, yeah, thank you for bringing that up. That's really important. The next one is team-based learning. Does anybody do team-based learning? So this one is, I think, a little more resource intensive than like the flipped classroom model. And so this is like three separate phases. Phase 1 is preparation, which is this like, again, is individual. It's usually some type of guided learning of material. Then they come to the classroom session. There's some type of readiness assessment. It's an individual test. Usually you can do a team test. then there's class discussion, and then afterwards there's some type of new material where they apply what they just learned. And again, there's usually an individual, a team, and then a discussion afterwards. And they do make like these readiness assessment tests. There's like these little quick like scratch off sheets that a lot of people use. But this is time and resource intensive to move forward with. And then lastly, there's like problem-based learning or case-based learning, and this is beyond just like using a case. And so usually there's some type of case assigned or some type of problem assigned to a group, and then the group kind of works through that case. They identify their own learning needs. Usually then they go away, and then they come back, and they share their learning, and then apply it to the assigned problem. Anybody use problem-based learning? Yeah. Any tips you want to share about that or experience?
I think we use it in a construct of the actual part of the residency didactic. So when the students get in there, they feel like they have a little bit more input too, because they're also looking up this problem for the residency. And I feel like they're more comfortable with this kind of presentation or delivering information than basic just knowledge.
Mm-hmm. Yeah. And in this one, you usually have to have a good facilitator, so it's a lot around, because like the actual facilitator doesn't have to be a content expert per se, but they have to be a really good facilitator to make, and they need training and facilitation to make sure they can help the group develop and help them, stay on track and get what they need out of the case. And so now we will do Think, Pair, Share. And so we'll take just like 2 minutes now that we've kind of gone through some different ways to add more active learning into activities, particularly into the lecture. We'll give you like 2 minutes just to think on your own. Is there anything that you felt inspired by or made you think about that you might want to change in one of your courses? And then we'll have you guys kind of share at your tables, and then we'll report out. So, all right. 2 minutes. Go ahead. You can think on your own, and then we'll share.
Sure.
Two fellows, and then all faculty. So that
maybe one more minute in your groups.
I don't know, maybe it's another conversation. I find TBL research about yourself really well done, practice oriented. There's like reading executions, for example, you know, you're like going TBL or like tumor test-based problems or, but I find it harder for more complex content. Like I feel like it lends itself to things with different processes. Nothing too complicated. It's just like respiratory versus metabolic, you know, I'm not gonna do physiology.
All right. Well, we'll come back together now. Lots of talk at the tables. This is good. All right. I heard a lot of enthusiastic chatting. So, does anybody want to share some points from their group discussion, or some ideas that they had, or a lingering question where they want to crowdsource some tips to move their idea forward?
We had a great discussion about how for the ultrasound course we have like 2 or 3 students per block, but we also have residents and fellows, and so we often run into the problem of the students presenting on the same topic over and over and over again, which is not beneficial to the fellows, and trying to get the residents to a higher level of performance compared to students, because I am giving students so much attention, the residents don't get as much attention. And so the idea is that we're forced to solve that, where to take make a topic list, put that over a time period, 5 or 12 months or whatever number of blocks, and then have the students engage with the residents and the fellows about those topics during that month in a team-based kind of problem or kind of like feedback, where they bring up the topic, the resident, the fellow says, oh, you know, there's a research paper about that, and there's you know, other information, and then having a collaborative discussion or team-based activity related to that topic.
Yeah, that's awesome. Great. Any other thoughts, or anybody else want to share any inspiration that they had?
You talked about like just kind of ways to like optimize some of the ideas, either depending on group size or what the topic is, to kind of like push like your ideas into a way that's going to be like fruitful for our learners. So do something interactive, you know, picking your time with the group size. You're going to pick something that you know like apply a team-based approach, like make sure it has a definitive answer rather than like the poison patient, like what's your answer? Yeah. Group size is really important, and I don't know about for you guys, but our enrollment can vary widely. We're our core EM course, or all of our EM courses are elective in the post-clerkship phase, and so there are some months where we have 8 students, and then there's some months where we have 16 students, which can sometimes make planning for some things more difficult, and so creating some creative solutions and other plans is important. All right. Yeah.
We have the same kind of thing, so we don't have we have transfers in the medical school that's not attached to our specific area. So we are loosely affiliated with like 3 or 4 different schools, but sometimes they come in, sometimes they don't, sometimes it's just one person on the M3 clerkship, and then sometimes it's M4, it's just one graduating filter and stuff. So for the most part, we have a maximum of like 5 to 6 in a month. Are there specific active ways that engaging in smaller groups that you found that works better for the smaller groups than the bigger groups?
I think it's like for us, we don't ever get down to just like
one student, and so usually we usually have like more than that, and so I think it's about like, you know, we don't do case-based learning or team-based learning because it just becomes too difficult to manage and to know the number of facilitators, right? If I think we're going to have 10 students and then we only have 4, that's not a problem, but if I think we're going to have 4 and then all of a sudden we have 10 and then I'm trying to find other facilitators and things like that, and so we tend to do things that are just more like flexible, like for simulation, right? Like, you know, we block the max amount of time if we get our maximum enrollment to 16, like we have that time blocked off and we're prepared, but it's not a big deal if we go, you know, if we go below, and so usually we try and book everything for like expanded, and then usually we at least have a minimum of like 4, and so they can usually serve as one group, and then as we get above that, then we can kind of break things apart, and so for that reason we do tend to shy away from some of the other problem-based and